So hi everyone. I want to welcome Dr. Flora Sinha. She is a board certified uh, internal medicine physician. She practices in California. And today we're going to be talking about secondary infertility, a topic that I have more awareness about because of Dr. Sinha, who I follow on Instagram and also have had the pleasure of meeting in real life about 2 years ago now. And so before we get into talking about this subject, can you just tell our viewers sort of how you got into internal medicine and how your primary care practice has shifted towards women's health and, just sort of your experience in treating women?
Yeah. Well, first of all, thanks for having me. I initially went into college not wanting to do medicine at all. I went in as a business major. And then through volunteering experiences, one, I didn't like business at all. And the classes I took, just never really gelled with me. So I started volunteering, but I think what really sealed the deal for me to go into medicine was my experience in Africa. I had volunteered there for HIV/AIDS education. And my homestay sister actually tested positive for for HIV. And so, I went through kind of maneuvering through how to get her access to medical care. We were in the village and um, far from urban areas and medical care. And so just kind of going through that entire process of teaching and coordinating care, it kind of dawned on me and confirmed my decision, like this is it. I need to do medicine. And as far as internal medicine goes, honestly, I love, knowing a little bit about everything and doing my rotations during medical school. That is what really spoke to me. And then outpatient medicine, I further went into after residency because I love building relationships with patients. I think it's so important, and I feel really passionate about preventative care. And then it kind of, my practice, I didn't mean to tailor my practice into a women's health practice. But I feel like female patients, I gravitate towards them and vice versa. And, female patients do need to be treated a little bit differently. We have different risk factors and, we have a very complex hormonal system. And there's just so many things that go into this that piqued my interest. And I kind of just went from there.
Yeah, no, I totally agree with you. I think just you're so relatable, and I would love to see you as my doctor, but you're on the West Coast. But yeah, I think that you also have a lot to share from your personal experience. And I know you talk about this a lot on your social media. And so I'm just going to dive right in. We're talking about secondary infertility, which is basically, actually, I'll let you explain what it is. But so what is secondary infertility, and, what was your sort of introduction to it in your own life?
Yeah. So secondary infertility is basically when you are unable to conceive after successfully conceiving. And that's basically what happened to me. So my daughter is almost 5. I had her in when I was 30, almost 31. And conceiving her was not a problem. I waited till after I was done with residency. That's when I felt most comfortable.
Mhm.
And I never expected to have issues getting pregnant again. Um, my goal was to have 2 to 3 children and live happily ever after. And realized quickly, after Gio was born, I went through postpartum depression. And looking back, it really made sense why I was so hesitant to start for baby number 2. And so I waited 3 years and we started trying again. And it quickly came to me that, we were going to have issues. It wasn't just stress or difficult schedules. This was a much different experience than the first time.
Uh-huh.
I actually went out to seek medical care through an IVF doctor after about 9 months of trying and being unsuccessful. And
And
she
how
told
how old were you then when you first started going to IVF?
Yeah, 30. Oh, when I first started IVF, I was 34. And then I had visited the IVF doctor at 33.
Okay.
So,
Pretty young. I mean, that's
yeah,
young.
absolutely. but again, all I knew from my medical training is, and because I counseled my own patients about this all the time, after a year, if you're under 35, after a year of trying, you should seek medical care. And so I took into account, time lapses and delays. So I went 3 months early.
Yeah.
I was told I was too young to seek care for secondary infertility, which I didn't know that was a term at that time.
Okay.
We did some initial tests, but they said to keep trying and to come back. Didn't get the greatest vibe from that. And so I decided, we did try for 3 more months, obviously was not successful. So after I turned 34 is when I switched IVF doctors and kind of started all over again, and kind of ran from there.
And how many sort of cycles did you do? Did you do a cycle with the first doctor or no?
I did not, no. I knew this was going to be an involved journey, and I really wanted to make sure that I picked a doctor who I trusted and would listen to me and my concerns. And you're right. Textbook wise, I was young, and I didn't fit the typical description of an elderly patient who's trying to get pregnant.
But you said you had been trying for a year, and I think above 35, the recommendation is 6 months, correct?
Right.
Yeah,
Yeah,
'cause that's when, I mean, I actually, I ended up conceiving naturally, but after 6 months of trying, sought help from an
yeah,
IVF physician, and it was during actually our workup that I became pregnant naturally, like
yeah,
fortunately.
right,
But yeah, I mean, I think after 35, that time is only 6 months to wait. Um,
correct.
and when you had those tests done initially, were they normal?
So, yeah, they were overall normal. There was some, and here's the thing with these tests. I think um, this is already a really sensitive topic, and so as a patient, and I can also speak for other patients as well, just knowing their thought process, we depend and we put a lot of emphasis on lab results, right? And so those lab results showed that some of my hormone levels may indicate that I had premature ovarian failure, which means I wasn't producing any eggs, but I was still having my menstrual cycles, and so things just didn't really add up to me, which is why I wanted to pursue further workup and evaluation to see, is there a reason I'm not getting pregnant, and what can I do about it?
Right.
After the workup, with the second doctor, we realized that one of my fallopian tubes was blocked, and we have no idea why. Which means that the eggs couldn't travel appropriately for implantation, and it doesn't eliminate my chances because the other fallopian tube was fine, but that's the only reason we could come up with. And I did have a lower than normal egg count as well, after, going through the process. So, all of that mixed together, it kind of makes me go back and realize, like, maybe Gia, my daughter, maybe she was my miracle baby. Like, I don't know how long this had been going on for. I always had normal periods. I don't know what changed in
Mhm.
2 to 3 years in between having Gia and trying. So, all these questions kind of come up, all the what ifs. But at that time, my mindset was, okay, I got to do this. Let's try. Let's figure out what's going on, and let's see if we can get pregnant.
Were you able to reconcile any of your questions with answers over the journey of doing IVF? And how many cycles did you end up doing?
So I ended up doing 3 cycles, but one of them was like a dummy cycle. So my first cycle was unsuccessful. Um, and immediately my fertility doctor, and this is why I love her. I mean, she was so proactive, and she said everything looked perfect, and she was so surprised that it was unsuccessful. So she said, let's do a dummy cycle. And so we did something called an ERA, which basically it tests the receptors inside the uterus to
Okay.
see if those receptors are ready for an IVF implantation during the normal standard hours after trigger. And So you go through the entire cycle, but instead of having an implant, you get a biopsy. So they take a biopsy of the uterus, they send it to, I think this lab sent it to Spain, and it's like a huge turnaround time. We waited and we found out that my receptors were not receptive at
Mhm.
the standard time, what that is standard of care. So during my third cycle, we implanted a few hours earlier, actually, because that's what the test results had shown that I was most prone to getting pregnant from. After my third cycle, I actually did get pregnant. And then at 6 weeks, I unfortunately suffered a miscarriage, which was completely unexpected. And, during that time, I knew it was early and I knew my chances. And just, with a naturally conceived pregnancy, chances of miscarriages are relatively high as well in the first few months. So, I definitely kept my head straight, but then I felt very familiar pregnancy symptoms.
Mhm.
And, you can't help but let your mind wander a little bit.
Yeah.
But yeah, I mean, and then after the miscarriage, my husband and I really sat down and had a talk, and we were like, how badly do we want this? Do we want this so badly that we're going to, in a way, sacrifice another year? Where at this point we've already sacrificed 2 years because we took breaks in between cycles. um, we kind of reflected and realized at that point in time, we really valued what we had and valued Gia, and we kind of lost a lot of time with each other and with family and with our daughter.
Yeah.
And so we decided to just put it to rest
Mhm.
and move forward with what we've been blessed with. And that's not the right decision for everybody.
Right.
And
Yeah.
I just want to make sure others know that it's okay to stop. It's an okay decision to make if your heart's really not fully into it. And mine wasn't at that time.
Yeah, I mean, that's got to be tough too, because I think for a lot of people, they think I've spent all this time, all this money, and I have nothing to show for it,
Yeah.
and that's incredibly frustrating. And so, like the concept is like, well, I'm just going to try again, try again, try again, because then you think, okay, well, if I eventually have a baby, then it made all of that
That's it.
worth it.
Absolutely.
But but right, I mean, what are you losing during that time?
Yeah. And I think it's important to differentiate your true wants, right? Do you want this because of the sacrifice? Do you want it because it'll make it worth it, like you said? Or do you truly, truly want a second or third or, a child? And so again, and it's not a popular decision, but like I said, at that point in time, and this was, not even a year ago, we were just like, we need to stop. We weren't gelling, things weren't sitting right with either one of us. And also what Gio was seeing, I was labeled as sick mommy because a lot of the times I didn't feel well and she couldn't touch my belly and all of these things, and I didn't want that to be what she remembered about me when she was, 3, 4 years old. So that really, really hit me. And I, and never say never, but as of right now,
Yeah.
we're good. Yeah.
Yeah. And do you have any embryos that could potentially be used down the line?
Yeah. I have one left.
Okay. Okay.
Still frozen.
Yeah. Well, I have eggs frozen that have yet to be turned into embryos, and um, it's interesting, right? Like a lot of people are like, "Well, are you going to use them?" And I'm like, "Well, I don't know. I mean, we have to turn them into embryo. Well, right now with the pandemic and everything, it's kind of
Yes.
a little bit on the back burner. But but yeah, I mean, nothing's a guarantee. I had a friend who had 25 eggs frozen and not one of them became an
Oh
embryo.
my gosh.
And so there is a lot of, you have to do a lot of preparation mentally. And this is my next question for you is, so, I mean, how do you get into that mindset of dealing with this and also making the decision to stop and not in the back of your mind sort of putting your hopes on that one last embryo?
Yeah. I mean, I'll be honest, my first round, I was not in the mindset. I was, and as a lot of, fertility, infertility warriors know that, you're dealing with a whole new schedule that's unpredictable. It's not a routine schedule. So not only was I dealing with my regular, commute, practice, toddler, a husband who's also a physician who has an incredibly unpredictable schedule, but I was also dealing with an IVF schedule and had to coordinate everything. And I spiraled. It was so much guilt and negativity and all of the comments, the unsolicited advice that you get about family planning. And some of it was cultural, within my family, and some of it was not. I mean, I would get random, strangers at the park asking me if I was going to give my daughter a child. And, going through that, it really put me in a negative space. I took a break after my first IVF cycle. I was in so much pain and I just wasn't in the right mindset to pursue another one. After talking to my doctor and Sanjay, I realized I really had to let go of that guilt. Me giving up my 20s was not me giving up anything. I had gained a full-on education. I became a doctor. I'm doing what I intended to do. And all of those experiences, I can't discount them. My only purpose in life was not to get pregnant. And at that time, that wasn't my goal. And then I also, I also acknowledged my feelings. The fact that I was angry and the fact that I was angry, I was envious. I mean, we're also in an age group where people are having their second, third children. So I had, friends and neighbors easily getting pregnant and growing their families. And that's all I wanted to do for myself, yet I had no control over that. So me acknowledging all of that and kind of sitting in them and ignoring all of the, I call it the at least game. Everyone tries to make you feel better and they say, at least you have Gia and at least you have this. And I know I have all of that. If it were that easy, I would be fine.
Yeah.
And so kind of sitting in that, acknowledging it, and then also being transparent, really helped me. And that's one of the reasons I actually opened up on social media, is that, being vulnerable takes a whole different strength. You really have to dig deep and to be able to verbalize those feelings, takes a certain sense of acknowledgement. And, it all kind of changed my outlook of, my expectations need to just go out the window. And I just need to put my head down and do this without really giving up who I am and what I mean to my family. And so, instead of angrily responding to a lot of unsolicited advice and questions, I would be actually pretty open. I'm like, well, I'm actually trying right now. I'm going through IVF. My first cycle was unsuccessful. And they would just kind of like look back at me. And I'm like, well, if you're not ready to have that conversation, don't ask.
Yeah.
And I would get patience. And I mean, it was such a bombardment of
Yeah.
comments.
Yeah.
Um, but I think people started realizing that, this is a very personal topic and some people aren't open to talk about it and they want to be private, which is completely fine. But that's what helped me kind of go through the dummy cycle, ERA, and the second cycle, and actually my miscarriage. I think I was able to make that decision because I was in a healthier mindset. I mean, trust me, I was broken after my miscarriage. I was devastated.
Oh,
And still, it still stings. I still see, siblings and all of these things that just kind of puts a little more salt in the wound. But I'm able to acknowledge that one and then move forward because there's so much more to give. I have a life, and I think putting that perspective into place really helped me move past it and
yeah.
be.
It's really easy to focus on, oh, I should have had kids in my 20s, but you're right. You were doing so many other valuable things in your 20s, and maybe you wouldn't have been a doctor if you had, 5 kids in your 20s or 3 kids in your 20s or 2 kids in your 20s, who knows, I mean, I think as a new mom, I can tell you, I don't know if I could have handled, I I really have so much more admiration for a lot of women who had kids in residency and med school, because it is it is exhausting. It's so much work, and I'm very grateful for having them now. Um, and actually, I will say, like, I know it must have been incredibly hard for you to share all that on social media and so publicly and so openly. But I mean, from a purely personally selfish standpoint, I mean, I'm so grateful you did, because I have also, I don't want to say like set my expectations differently, but I'm going to be 38, and I now know that this is something that could happen to me. And I think that knowing that in and of itself, just kind of going in mentally prepared that, okay, I had one kid successfully, and I mean, it took a little bit of effort, but not
Yeah.
too long.
Yeah.
And now I'm, a whole 2 years older, and so it could be something, and I have to be ready if that is the case. And um, it's strange, right? Because you look at someone who has one child and you think, well, of course, like, why wouldn't they have a second one? Like, it's it's a fluid situation. Um, but any other sort of final tips to give women who dealing with either primary or secondary infertility, sort of on how you got through it, and anything that they can do aside from obviously seeing an REI specialist, to do, and finding one that they're very comfortable with, obviously.
Yeah, yeah, I think that's huge. And I know a lot of people have also written about, doctor shopping, and not, and it gets a negative connotation, but also, you need to really feel comfortable. This is a long, very personal journey, and any type of infertility. And it's really important that, you trust your doctor and you have a good relationship in order to move forward, because mindset is so important during this whole thing. I mean, with hormones also messing with physical attributes and your mental state, there needs to be a good foundation. And as far as advice goes, I mean, I kind of mentioned it before, as far as it's okay to acknowledge those, quote, negative feelings. They're natural, they're normal. And it's also okay to, correct friends and family, and it's okay to be transparent about it. And if you don't feel comfortable talking about it, it's okay to say that. And I think if we make this more of a regular conversation without anger and defensiveness and guilt meddled into it, which is natural, I think, society as a whole, but especially our South Asian culture, it, someone will think twice before asking such a personal question or giving advice, or even giving, you potential reasons of why you can't get pregnant again.
Yeah.
All of which have happened to me, and I'm sure a lot of people. So, I think it's important to kind of be in that mindset, let go of expectations, really educate yourself too. Because there's still, I mean, just even being in the medical field, there's so much I learned, and during this whole process, from a medical standpoint, from a patient perspective, I mean, it really puts a whole new outlook, which is what now it really changes the way I address my own patients, and what they're going through, because kind of going in blind and going through this process blind, it's hard, it's nerve-wracking, frustrating.
Yeah.
um, it doesn't help. Yeah.
I love the non-scientific unsolicited advice. Like, everyone's like, well, like, they're like, why are you usually, I used to get why are you using ovulation sticks? That's just going to stress you out. I'm like, actually, it stresses me out less. I was like, because I am a person who requires order, and I need to know when I'm ovulating. It helps me. So,
Yeah.
I mean, it's different for everybody, right?
Exactly. That's the thing. It's different for everybody, and do what works for you without driving yourself completely crazy. There are plenty of medications to help you do that. But it really is about mindset, I think. And I've applied that whole theory into now everything,
Yeah.
into, how I address work and family life, and this work life integration, and just really taking steps to help better myself and my own balance. So this whole experience, as you can always put a positive spin on anything, but it really has changed my outlook on a lot of things. So yeah.
Well, I mean, kudos to you for going through such a rough journey, but coming out, a better person, a more enlightened person, uh, and you share so much of this on social. And so, where can people find you to get more of your advice and sort of if they want to ask you more about secondary infertility, or and you talk about a lot of women's health topics, so not just limited to that, but what's a good place for people to find you?
I'm primarily on Instagram. My handle is at Dr. Dr. Flo Sinha. And yeah, if I'm an open book, so feel free to message me, to any follower who has questions, and just needs support, because that's what I'm there for.
Yeah, and that's actually true because before we started chatting, I did ask her, I said, well, is there anything that you want me to stay away from? Because I won't ask you that. And she says, absolutely not. So definitely we're all grateful for that. And thank you so much for sharing. I know it's a very personal subject. So, I really appreciate it. Everyone watching really appreciates it. And everyone who has ever asked an unsolicited question will probably dial back a little bit after seeing this. So
I hope so. Well, thank you so much for having me. I really appreciate this opportunity.